I am Dr. Heather Moore. Tonight we're going to go over common causes of upper back pain. And a lot of this is obviously posture related, but there are some different things that can be causing upper back pain. And we don't always talk about this. We talk about a lot of lower back pain or a lot of neck pain, but people have some real issues. A lot of times it will start in your neck and then go to your upper back, but many times it can just start in your upper back. So I'm talking about the area in between your shoulder blades and kind of coming out towards your shoulder. So not quite your neck, not quite your low back, but right in the middle, that upper back pain. So the first common cause is poor posture. So a lot of us sit like this many times, or we're looking on our phone and we're like this and we're hunched over. And this doesn't only affect your neck, it also affects that upper back, that part of the back that needs to be stretched forward in order for you to be able to be in this position. So many of us have an improper setting on our keyboard or our laptop or our workstation that actually causes us to be sitting like this. And you really want to make sure that you're getting up at every 15 minutes. People always ask me, when they see how I sit at my desk or how our front desk is set up, and they say, well, you guys don't have an ergonomically correct desk. And I would argue not many of us sit for more than 15 minutes around here before we're up and moving. So if you find that you're constantly moving and you're constantly being called away, posture is probably not a big thing for you. But most of us and most people sit at their computer for hours and hours and hours, or they get lost in the TV, or they Netflix binge, and you're winding up with this rounded posture. So if that is the case, you really want to make sure you're rolling your shoulders up back and dropping them down. The second common cause of back pain is from a pinched nerve. And what that can be coming from is that could be a pinched nerve in your neck, or that could be a pinched nerve actually in your mid-back area and where the discs are actually sitting. So you may feel burning, you may feel numbness, you may feel tingling, you may feel fatigue. Those are common symptoms that go along with a pinched nerve. Now, a lot of times a pinched nerve is going to see some relief if you either arch back or maybe you do slump forward and you kind of get rid of some of that pain. That can be an indication of a pinched nerve that's actually being relieved. So if you find that you have a pinched nerve, and sometimes you can even have numbness and tingling into your fingers, or you can start dropping things, that's signs of nerve involvement. You want to get that checked out as soon as you possibly can and make sure. The third thing is actually a herniated disc, which is going along the exact same thing as a pinched nerve. A lot of times people come in and don't really understand the difference, and there really isn't. If there's a nerve issue, there's a nerve issue, but a herniated disc refers just to that disc being herniated and can affect the nerve. So as you slump forward, you actually are herniating your disc, and you're causing your disc to bulge. And as you cause your disc to bulge, you wind up actually pushing against the nerve. So you can get numbness and tingling into your hands, you can get numbness and tingling into your fingers, you can get it into your upper arm. So any of that numbness, burning, tingling, that's a nerve issue. That's something you want to have checked out. That could be coming from the disc. It could be from nerve being pinched or caught up in a muscle. But you do want to get that checked out, because that does lead to eventually losing strength or being clumsy and dropping things, when that actually really means that you're losing strength. The next common cause of upper back pain is overuse. So a lot of times your muscles can be overused. And yes, sitting like this is actually causing your muscles to be overused. Your muscles are being overused in the wrong direction, okay? They're winding up slouching forward, and you're really causing them a lot of pain. A lot of times some people will be sitting up and they'll be sitting too straight, or they'll be pulling their shoulders back like that. So that's a very common way to overcorrect for shoulder issues. And then when you wind up pinching your shoulder blades, you wind up overusing them. As people get back into the gym, ready for spring break, looking for bathing suit season to come along, you wind up with that overuse when it comes to lifting a lot of weight. So that the caveat with lifting is it does take about 24 to 48 hours to come on. So if you go to the gym and you lift and you really feel pain right away, that's not usually something to do with muscle soreness from lifting too much. That's you strained something, you did something to a muscle. So you definitely get that checked out. But you have that, we call it delayed onset muscle soreness, 24 to 48 hours. Should go away 24 to 48 hours after that. And if it doesn't, that's the sign of a problem. You really want to get that checked out. That means there's either a strain in the muscle, you've sprained a ligament, something has occurred in the upper back. The next thing that you could possibly would be causing upper back pain is pneumonia. And unfortunately, as the cold weather hits and we're all hacking and coughing and have stuffy noses, pneumonia is more and more prevalent. So pneumonia can be a reason. If you find that you're having difficulty breathing or you're winding up with short of breath or pain in your upper back, and you have this cold that doesn't go away, and it is pneumonia, and you do want to get it checked out because it's definitely something that you don't want to ignore. And finally, a very serious cause could be some heart problems. So if you're winding up with that pain in your upper back, it could be some issues going on with your heart that you would want to get checked out. But a lot of times, most of the upper back pain that you feel is directly related to poor posture, is directly related to sitting like this, and just having that muscle overused.